Good morning, everyone. Sorry to keep you waiting. Last night, shortly after 7 p.m, we announced some further changes to our border controls with New South Wales. This has been a fast-evolving situation, and I appreciate everyone's collaboration over the last 24 hours. We've had to act extremely fast and do what is best to protect our state from a COVID-19 outbreak. I'd like to acknowledge the work of the Police Commissioner, Chris Dawson, Chief Health Officer, Dr. Andrew Robertson, and their teams for the important work they are doing to keep us safe. I understand the changes made have thrown many people's plans into disarray. I know that must be very difficult to deal with, but we cannot afford to take unnecessary risks here. We can see the devastating impacts of the virus all around us, from Britain to the United States of America. This is a deadly global pandemic. We cannot forget that. I want to thank everyone for their cooperation and understanding as we implement these important changes. Western Australia is taking these important and extra cautious steps based on the most up-to-date expert health advice. Like I said last night, we are very concerned there will be many more community cases in New South Wales. And I note a further 10 cases have already been announced this morning. We've just come from an emergency meeting and been briefed by our Chief Health Officer on the latest situation in New South Wales. There is no doubt New South Wales is on the verge of a serious outbreak, and we must do whatever is required to keep us safe. Unfortunately, a case has now been recorded in Queensland, linked to the Sydney cluster, a person who travelled to Queensland by air just 2 days ago. This shows how the virus can spread, and it can spread quickly. Our best defence to keep COVID-19 out of our community is border controls. WA's controlled interstate border is in place for that very reason. Between December 11 and December 17, Western Australia has had 4,901 arrivals from New South Wales. This includes 616 people who have come from other parts of Australia but had been in New South Wales at one point in time since December 11. As a result of our border controls and the G2G pass travel registration, we've been able to reach out to each traveller and provide them with direct instructions. In addition, our contact tracers have followed up directly with 87 arrivals who have come from Sydney's northern beaches. This has been the added benefit of the controlled border, providing our health team and WA Police with the information they need to track down the people who are of greater risk. As expected, since our 3 p.m. announcement yesterday, our COVID testing clinics saw a significant increase in presentations. Yesterday, 1,936 people were tested at our public COVID clinics, including 522 at the airport on their arrival, with most of those arriving after our 3 p.m. announcement. This was a 172% jump on the 712 people that were tested at the clinics the day before. This is a very pleasing result to see that response. Those people are now in self-quarantine, awaiting their test results as per our lawful direction yesterday. I know many people have been caught in long lines and have had to wait for long periods. Thank you for your patience and for doing your bit to keep our community safe. WA Health have ramped up resources at our COVID clinics. Open hours have been extended across the Perth metro area and across our state. WA Health have also spoken to private pathology providers to ensure that if anyone presents for a test and has been in New South Wales since December 11, they are able to be tested. A full list of testing sites is being published on the WA Health website. Everyone is doing the best they can to respond in these very difficult circumstances. Based on the current health advice, we are not making further changes at this point to what we implemented at midnight last night. We will continue to monitor the situation extremely closely and do whatever is needed. This may well mean that the hard border with New South Wales needs to return in the near future. I will not hesitate to do that if that is what the health advice recommends. So can I ask all Western Australians to avoid travelling to New South Wales? If you can avoid your travel to New South Wales, please do. The situation is extremely fluid right now as we monitor and see what happens in the next 24 to 48 hours. I do want to note that it is pleasing to see New South Wales has decided to take on Western Australia's dedicated aircrew hotel quarantine system. That is something WA has had in place for 4 months, and it works well, where all international aircrew are required to hotel quarantine in a dedicated hotel under strict supervision. I highly recommend this system, as it has now helped keep Western Australia safe and COVID-free for 251 days now. Just to repeat, what changes we introduced from midnight last night? Travel from New South Wales into WA is now classified as low risk. That means people arriving from New South Wales must self-quarantine for 14 days and present for a COVID-19 test on day 11. Anyone who has arrived from or been in New South Wales between December 11 and 17 will be contacted by WA Police and must self-quarantine until they receive a negative COVID-19 test result. Initially, we said that test was required within 24 hours, but based on advice from WA Health, we've extended this and allowed people to be tested by Saturday night, that is, midnight on Saturday night. I understand this is a difficult period for many. I understand this must be very upsetting for families looking to reunite and spend Christmas together. As you know, my parents and my brother live in New South Wales. I wasn't planning on seeing them at Christmas. However, I, like many people, am worried about what might happen to our friends and family that live in New South Wales. We're thinking of them and we support the people of New South Wales. This is going to be a very different Christmas for many people,